Yoga can aid in COVID-19 respiratory recovery, according to research. Nearly 10% of persons infected with COVID-19 have symptoms that continue weeks, months, or even years after testing positive for the new coronavirus. These symptoms include problems breathing, blood clots, headaches, nausea, muscular soreness, and exhaustion. Yoga teachers and yoga therapists, certified practitioners who use yoga to address specific physical and mental health issues, have been working with COVID long-haul patients to help them cope with stress and pain, maintain mobility, and breathe more easily, and science is now beginning to back up their claims. Researchers from the Loma Linda University School of Medicine in California conducted a meta-analysis of effective pulmonary, or lung, rehabilitation treatments late last year and discovered that diaphragm-strengthening breathing exercises, think three-part yogic breathing or Ujjayi pranayama, and stretching, asana or gentle movement coordinated with the breath, are important for recovery. Their research, which was published in the journal Physical Medicine and Rehabilitation, suggests a sequence of breathing exercises according on the degree of symptoms, all of which are aimed at rebuilding respiratory muscles damaged by COVID-19. Another evaluation of post-acute COVID therapy, published in the journal BMJ this summer, suggests using breath control techniques like Ujjayi and pranayama. Dr. Ingrid Yang, a doctor and yoga therapist, has been treating COVID patients since the outbreak began, FC. She currently uses pranayama and asana techniques to treat systemic stress and inflammation, as well as educate patients how to breathe more easily after a COVID infection. The course, which is co-hosted by the International Association of Yoga Therapists, IAYT, and Give Back Yoga University, aims to assist COVID patients and caregivers find accessible strategies to recover. Acute respiratory distress syndrome, or ARDS, is a condition in which fluid seeps into the lungs, breathing becomes difficult, and the body fights to acquire the oxygen it requires. While yoga won't restore elastin, it can educate them how to accept their new normal and breathe more deeply, according to Yang. She teaches breathing exercises and postures that assist keep the lungs open by putting enough pressure on them.